Hello, I'm going to demonstrate the update of AI assistant for breast cancer detection. The first thing I'm going to do is to ask the agent to give a self-introduction real quick, and then I will use this image here containing four standard views of a mammogram. Strictly speaking, it's not a regular way that we feed mammograms into the models, but I want to test out the performance with respect to this layout, combining four mammograms together. Also, please ignore the accuracy of the output since I haven't fine-tuned the model seriously yet. Okay, let's get started. Hello?
Hi there, I'm RIL. What can I help with today?
Can you give a brief self-introduction and what you can do?
Of course. I'm RIL, an advanced AI agent specializing in breast cancer risk assessment. My primary role is to analyze mammographic images and provide personalized risk scores for the likelihood of developing breast cancer over the next 5 years. By utilizing advanced deep learning models, I can help clinicians with 1. Risk assessment. I generate clear, interpretable risk scores for the next 5 years. 2. Risk stratification. I classify patients into low risk, average risk, or high risk categories based on their scores. 3. Clinical interpretation. I provide concise explanations of the imaging findings and justify the risk scores.
Okay, I got
4.
it. Can I upload
Clinical
some
recommendations.
mammograms and information to you?
Based on the level of risk, I suggest... Yes, absolutely. Please proceed with uploading the mammographic images and any additional supporting information you'd like to share. Once I've received the data, I'll analyze the images and provide personalized 5-year risk scores, along with a clinical interpretation and recommendations. Let me know when you're ready.
Okay, I typed the information of this case beforehand, and I'm gonna fit them into the agent along with the mammogram I showed you previously. So I'm gonna open it up here and upload the image, but it won't show in this screen because the app doesn't capture the process for uploading the image. Okay, image upload is done, and then I will click enter and see what happened.
Thank you for providing the necessary information and images. Based on my analysis and the provided case details, here's an overview of the assessment. 1. Risk scores. Year 1, 20%. Year 2, 28%. Year 3, 35%. Year 4, 42%. Year 5, 50%. 2. Risk stratification. Average risk. 3. Interpretation. Mammographic features exhibit heterogeneously dense breast tissue, the IRADS Category C, which is considered a moderate independent risk factor for breast cancer. Higher density can obscure small abnormalities and is associated with increased risk. No suspicious masses, microcalcifications, or architectural distortions are observed in the images provided. The imaging findings suggest no immediate signs of malignancy. A family history of breast cancer is noted and contributes to the elevated risk, though the absence of BRCA1/BRCA2 mutations and atypia reduces the likelihood of highly aggressive cancer types. 4. Clinical recommendations. Continue routine annual screening, given the average risk identified over the next 5 years. Mammography remains critical for consistent monitoring. Consider supplemental imaging modalities, such as ultrasound or MRI, especially due to high breast density, which could mask abnormalities on standard mammograms. Encourage discussions with a genetic counselor to reassess inherited risk periodically and explore preventive options if family history is significant. Maintain a healthy lifestyle and report any new breast changes promptly to your healthcare provider. Please let me know if you have questions or require additional information regarding the analysis.
Okay, I'm gonna stop here for time saving. The agent successfully provided the output such as risk scores, interpretation, and recommendations. Though it's not a perfect prototype, but this agent represents the future of AI for healthcare. Thank you.